The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.
If the pandemic is to define this election, then undoubtedly health care and long-term care will be top of mind for voters. Tonight, we talk to experts in both fields to find out what lessons our political leaders should take from the past 2 years and what promises are being made on the campaign trail to make both sectors better in the years to come. It's Thursday, May 5th, and that's tonight on The Agenda. Ontario's healthcare sector was hammered during this pandemic. Those who kept it functioning were labelled heroes. Now, as the politicians hit the hustings and the system continues to grapple with COVID-19, let's find out how well the party's healthcare promises match the needs going forward. And with us for that, we welcome in Davenport, Florida, near Orlando, registered nurse Catherine Hoy, who was president of the Ontario Nurses Association. In Thunder Bay, Ontario, Dr. Rose Zacharias, emergency medicine physician who practices at the Waypoint Centre for Mental Health in Penetanguishene and who started her term as president of the Ontario Medical Association just today. And in the West End of Ontario's capital city, Dr. Anna Banerjee, infectious disease specialist and associate professor of pediatrics at the U of T's Temerty Faculty of Medicine and the Dalla Lana School of Public Health. And Dr. Danielle Martin, family physician and chair of the Department of Family and Community Medicine at U of T. And it's great to have you four on our program tonight. Dr. Zacharias, congratulations, maybe, on your assuming your new responsibilities as head of the OMA. That is a job that tends to churn up its presidents, but good luck with that. Let me just, because you all have a different lens upon which you see the healthcare system, get you from your vantage point to tell us off the top here what you think the biggest problem the pandemic has caused in our healthcare system from your vantage point. Dr. Zacharias, why don't you go first?
Absolutely. And thank you for the congratulations, Steve. It's an honor, actually, to represent Ontario's 43,000 physicians. And indeed, I start my term today. But the backlog and really, the pandemic has exposed 21 million patient care procedures that have been waylaid during the crisis of COVID. And we recently had an opportunity to poll all of Ontarians, and they said this is the #1 priority. It's exposed that we're behind and also that we're exhausted. Teams of healthcare providers are indeed exhausted. It's been stressful, the pandemic, and that's really where we're at.
Dr. Danielle Martin, we had you on this program not too long ago talking about that very thing, but given a new opportunity to speak about this, what would you say is the biggest problem right now today?
My biggest concern right now, Steve, is the number of people who've become disconnected or loosely connected to their family doctor or primary care team, because we can't get people back in for the canceled procedures or the ultrasound or back up to date on their screening or back on track with their diabetes care or any of the things that have been pushed off and fallen through the cracks in the pandemic if people aren't closely connected to primary care. So I think that is the most important task ahead of us.
All right, Dr. Banerjee, what say you?
I'd say it's a lack of trust between physicians, nurses, and other front care providers, health care providers with the government. And the government has really basically ignored the advice of physicians, infectious disease specialists, public health specialists. And for example, throughout the pandemic, they refused to have sick days for people that were sick and people we knew had COVID, and they had to go back to work because they had no choice. And recently, for example, despite a lot of us saying that it's not safe, they removed the mask mandate for children, young children in schools where most of them are unvaccinated. So that's part of it. I think there's a huge mental health crisis right now, and there's not a lot of resources and lot of wait times. The other thing is that the Ontario government has ignored First Nations, and they've been left to fight COVID basically on their own. You know, when Ford said, you know, we need masks in every school, get HEPA filters, not one First Nation school got HEPA filters and the masks.
Catherine Hoy, how about from your vantage point?
I'd first like to thank you very much for the invite. It's such an honor. But listening to the other three speakers, it all comes down to, though, we cannot provide service because of the staffing crisis. The pandemic has led to a staffing crisis that we have never seen before. And the Ontario Nurses Association has been telling the government this for years. I would estimate we're at 30,000 nurses short plus healthcare professionals. And I would have thought that the government would have listened to the SARS report where it said your most important resources are your staffing. And they did not listen to that. Instead, staffing is the largest line item on a budget. So that is where they wanted to save the dollars. So we cannot provide the surgeries. We cannot help the family physicians. We cannot help schools. Everywhere that healthcare touches, because we do not have the staff. And the people of Ontario, they really need to listen. They really need to look at the platforms this election, because healthcare is number one. And your paycheck should never dictate what type of healthcare that you're going to receive. So for us, it comes down to staffing is the major problem of the pandemic.
Can I do a quick follow-up with you on that, Catherine Hoy, in as much as, thankfully, most of the 15 million people who live in the province of Ontario have not been and will not, during the course of this year, be in a hospital. There have been lots of people in hospital, but not 15 million. So we really need you to give us a better sense about when you say there's a staffing shortage, what that really looks like on the ground. What does it mean inside a hospital, at a school, etc.?
I think it's really important to remember that because 15 million have not been in a hospital, at some point in your life, you will be in a hospital. You will. So because it doesn't affect you right now, you need to think about your future. And that's what a government is all about. We have emergency rooms that are running at 50% capacity. That means if there should be 30 RNs in there, there's 15. We have nurses that have 30 patients in medicine units. We have emerge rooms that are having to close on weekends. We have labor and delivery units that are having to close. You go into labor and you have to drive another hour and a half so that you can deliver a baby. And what could happen in that hour and a half to make sure that everyone is safe? There is not enough staff, and the government cannot keep turning a blind eye to this. Your most important resource is your staff in healthcare. I mean, buildings are brick and mortar and empty beds at the end of the day, but if you don't have someone there at the bedside to care for someone, what is the point? What is the point in investing all this money? If you're going to invest money, as they're saying in a platform, you have to have a solid plan around that. They don't have a plan, nor have they looked at retention of what they're going to do to keep the existing staff there.
Well, let's look into all of this right now, because the reason we wanted you four on the program was to really put through the meat grinder the four platforms that the four major parties in the province who are running for election right now, what they have to say about healthcare, and then we're going to get your critical analysis of them. Let's start with the Progressive Conservative plan. It is centered on building infrastructure and addressing staffing shortages, and here's what they have on offer. Investing $40 billion in health and hospital infrastructure over 10 years, immediately spending $3.3 billion on hospitals, which includes $1.5 billion to support acute and critical care beds, and $300 million to address the surgical and diagnostic backlog, which we've had referenced here tonight. Investing $764 million over 2 years to retain nurses with incentives such as $5,000 per worker. We'll find out if that's doing the trick. Immediately invest $230 million to staff hospitals and the healthcare system, and invest $1 billion more in home care over the next 3 years, including a so-called Ontario Seniors Care at Home tax credit, which was just introduced in the last budget, which, as we all know, has not actually passed, but was introduced. All right, let's get some critical analysis of this. Dr. Zacharias, what do you like? What are you concerned about?
Well, indeed, I am heartened by the investment in staff and in system capacity, but I'm going to come alongside my colleague Catherine, and speak to the healthcare providers that are burnt out and are running on near empty, because that's where we need an investment in the human health resources. And I know what it's like to work in that emergency department. I've had 20 years of my medical career working hundreds of emergency department shifts and being called to the hallway where the paramedics have brought in someone with chest pain, and we need to determine right now how quickly we can get an ECG to determine if this patient is having a heart attack, and then probably ship them out to get the care they need at a catheterization lab and deal with these urgent crisis issues when we have a shortage of nurses and even physicians that are not able to show up for their shifts all the time because they're double booked and they are exhausted. We indeed did have some emergency department closures just recently in Ontario. And so we know burnout is at an all-time high. A recent Canadian poll showed 53% of physicians operating at high levels of burnout, and 46% of Canadian doctors are saying they intend to cut back clinically in the next 2 years. And so it's all well and good to say we're going to pour money into buildings and capital infrastructure if this is increasing capacity, because yes, we cannot do this type of medicine in the hallway, but we cannot forget the people. And that's a little bit more complex, a little bit more ambiguous, but this is where the strategy needs to go. How do we retain and how do we recruit? I come to you today from Thunder Bay. Northern Ontario is short over 350 doctors right now to do the care that we need to do right now. And yet the pandemic has backlogged us. And so we need to catch up. There's just an enormous amount of work and we need healthy people to provide the care. So this is what I'm looking to when the parties release their platforms. How are they going to address this?
Okay, Dr. Martin, you hear what the PC party has on offer. Do you think it will go some way towards dealing with the issues the healthcare system is facing today?
Of course, much of this, Steve, is necessary, but it's not going to be sufficient. And, you know, all of the platforms actually read like a classic Canadian approach to healthcare, which is, you know, we want to invest in healthcare quick. Let's look at hospitals. Let's look at doctors and nurses. But in fact, as you said earlier, most Ontarians this year will not visit a hospital. What most people need is access to primary care in their local communities. And so as we think about the build back out of this crisis, you know, a lot of the people who we end up seeing in the hospital or in the emergency department could have been better managed and supported closer to home if they have easy access to high quality primary care services. And that, I think, is where we really, it's never as sexy and it's never as easy to explain as, you know, investing in hospital beds, but actually it is the most critical foundational element of a healthcare system. And we can stop people from landing in the emergency department with heart attacks if we can control their blood pressure, their cholesterol, their stress level, and support them in quitting smoking. All of that happens closer to home in primary care, and that's where the investments are needed. And unfortunately, I'm not seeing a lot of conversation about that yet.
You're not seeing that in the PC platform so far? No.
That's right. I'm not seeing it. It's not. I don't see it as a platform priority in any of the platforms.
Okay, let's go on to Dr. Banerjee. You talked earlier in the first answer you gave about a lack of trust in the system. These items that I've just outlaid, do you think they will help to repair the lack of trust that you see in the system?
The money is important, but $40 billion, like, where's that going to come from? We recently had checks back for our driver's license, but what are they going to cut? You know, are they going to cut primary care? Are they going to cut nursing care? You know, so I think that money in some infrastructure is good, but it's not sufficient. We need to support nurses, especially, because I think that there really is a lack of trust. Like, why would we trust this government if they have, like, all of a sudden $40 billion to invest in infrastructure? Why didn't they pay the nurses more? Why do they have Bill 124 to limit the wages? And so I think that there's a lot of work to do.
All right, Catherine Hoy, the budget, as I say, that did not pass but was introduced, allocated $70 billion for this fiscal year for healthcare alone. That's record spending. You now see what else the PC party has on offer. How far do you think that'll go to address the issues you've raised earlier?
Well, we've already heard that, well, the budget hasn't passed, and he may not see through the budget. So trust is a big issue. I mean, we heard from the auditor that billions of dollars that were earmarked for COVID were not spent. So there is a trust issue. I said before, it's bricks and mortars and beds if you don't have staff. And this government has had 4 years to fix healthcare, but all they've done is made it worse. And so what are they going to do?
Really? Can I jump in there for a second?
They sure can.
They have made it worse? They really have made it worse?
Absolutely. They have made it worse. Look at the staffing crisis that we have now. Bill 124, that is a targeted bill to a female-dominated profession. I mean, for all the women here, all the people that have daughters and granddaughters, do you want them treated like that when we have a government that targeted a female-dominated profession? You know, try and explain that. And also when the government put into play Bill 195 that suspended our basic workplace rights, like nurses can't get vacation. They're burnt out, PTSD. And he's also looking at more privatization. And what does that do? So our tax dollars will go to new private facilities to provide care, which really means that care will go down, because when it's for profit, someone needs to make a profit.
Well,
so
let me
those
just,
dollars,
okay. I'm worried about letting the clock get away from me here, because we still got 3 more platforms to get through. But the only reason I pushed back a little bit, maybe Dr. Martin, you can respond to this. You know, did this government make healthcare worse, or did COVID-19 make healthcare worse in this province?
I mean, of course, it's got to be a little bit of column A and a little bit of column B, Steve. You know, and there's no government of any political stripe across this country that should stand up and wave the flag saying that they handled this pandemic perfectly. And that's also true in Ontario. That for sure, it's been an incredibly hard time, and that it's a global health crisis that has put every health system in the world, run by every kind of government, under tremendous stress and pressure. Did this government make mistakes? Yes, it did. And some of those mistakes were really important and cost lives and cost and increased pressure where it wasn't necessarily where it didn't need to be increased. And so, I mean, I would like to see any premier across this country or any territorial leader stand up and say they think they did a perfect job of it. I don't think anybody can. I think the question is, you know, we're here now. What's the build back going to look like? And are we prepared to learn from those mistakes? Are we prepared to say, okay, well, what did we learn in this pandemic? We learned virtual care can be used in ways that are actually effective and helpful. We learned that some communities are not at the same risk of getting sick as other communities. We learned that if you work an essential job on contract and you don't have benefits and you lose that job, you lose your drug coverage. We learned that mental health is actually part of the healthcare system and needs to be addressed. Like, those are actual, real lessons that came out of the things that were done right and the things that were done wrong by this government and others in the pandemic. So how are we going to take those lessons and actually use them to make a better healthcare system coming out of it? That's the conversation that we should be having.
Well, let's continue it here. Here's what the NDP has on offer for this 43rd general election campaign. Making mental health universal by expanding access and bringing therapy under Ontario's health insurance plan coverage, OHIP. Investing $130 million over 3 years to bolster children's mental health services and reduce wait lists to 30 days. Improve mental health crisis response through increased mobile crisis services and safe bed programs. Immediately hire 10,000 PSWs, 30,000 nurses, expedite recognition of 15,000 internationally trained nurses, and also hire 300 doctors in Northern Ontario. We've heard reference to the need for that. And eliminate Bill 124, which has also been referenced here. That would cap wage settlements at 1%. I'd like to know who we go to first here. Dr. Banerjee, start us off here. That's the NDP's Build Back Better. How does it sound to you?
I think that the focus is on mental health, which is really important after this crisis. And so I think they have a fairly good program. They're the only party that addresses the issues in Northern Ontario by increasing the number of physicians. And they say as well that they want to support Indigenous-led healthcare. And to me, when you have such differential access to treatment and treatment services, screening, et cetera, and funding, really, it's very unfair. And a lot of people would call that an apartheid system. And they're the only government so far that I can see where trying to address some of the issues in the North is part of their policy. I'm not surprised the PC doesn't have anything there, but I couldn't see anything liberal, but I do see that for the NDP party.
All right. Dr. Zacharias, I presume you're going to like the hiring 300 doctors for Northern Ontario, but you know as well as anybody, you can't just snap your fingers and 300 docs in the North appear. So how realistic is this plan?
So when I look at this plan and when I look at every party's plan, it's not a mystery to me how, and speaking to my esteemed colleague, Dr. Martin's question, what does this look like? What indeed does building a robust healthcare system after the pandemic, what does it look like? And so Ontario's doctors actually, speaking to the relationship of trust, have written a prescription for Ontario. After our most extensive consultation in our 140-year history at the Ontario Medical Association, we are putting forward a prescription that lays it out, achievable, realistic goals. People can read about it at betterhealthcare.ca, but we've designed it around 5 pillars, addressing the mental health tsunami that indeed is coming now after the stress and strain of COVID, but also that investment in community and home care, as we were just talking about, catching up on the backlog, also developing a public health strategy so that when the next crisis comes our way. I mean, Ontarians, they paid such a price in restrictions and lockdowns while we worked to save the healthcare system. And we need to have a better plan. We are at a different place now. March 2020, with no vaccines and no particular plan how to address a pandemic, we have learned so much more. So we need to invest in the public health knowledge and infrastructure to be prepared for the next time so it doesn't cost us so much. And lastly, we've spoken to this, but 1 million people in Ontario still don't have a family doctor. And so our 5th pillar in our prescription for Ontario is providing every Ontarian with a family doctor and a healthcare team that's wrapped around them and is digitally connected so that we take advantage of the virtual advancements we've made as we were forced to in COVID and use that to the advantage of providing better care for people. That's what I would say.
All right. Catherine Hoy, I see in here 30,000 nurses, 15,000 internationally trained nurses having their credentials recognized. You talked about the need for 30,000 nurses, but again, you can't snap your fingers and have them show up tomorrow. How realistic is this plan?
The plan could be realistic if they would work with ONA, to be brutally honest. I have spoken with the Premier in the last several months about developing a program for the RPNs, a fast-track program.
Registered practical nurses.
Registered practical nurses so they can become registered nurses. They've increased the seating in the RN program, but we're not going to see those results for 4 to 5 years, and we cannot wait 4 to 5 years for those nurses. So we need a fast-track program. And that's where money should be spent. Money should be spent on retaining and growing more registered nurses to put into the system. And we need to work together. We need to work together, and the NDP government has committed that they would do that.
Well, they're not the government yet. They're trying to become the government.
They're not the government yet, but we're just talking about their platform.
Right. All right. Let me get Danielle Martin for a word on the NDP platform and what you think about that.
I agree with you, Steve, that it's wonderful and important to talk about hiring more nurses and bringing doctors to where they're needed. But those are things that are much more easily said than done. And so I think, the important thing in this platform to remember is that probably if we actually want to achieve goals like this, we're going to have to grow the team, right? And that means, look, I train family doctors for a living. I would love to just train more family doctors, but actually the way you get more primary care to people is by growing the interprofessional team, by making sure the pharmacist is doing the parts that the pharmacist can do, the social worker is doing the parts that the social worker can do, the nurse is doing the parts that the nurse can do, and then you actually don't need as many family doctors, and some of those family doctors can be at a distance, et cetera. And so a lot of this stuff is actually going to be about the impact may be the same down the road, but it's never really about hiring doctors and nurses. If you really want to have an impact on access to care, you have to grow the team. And admittedly, those are not easy things to fit into the bullet points of a political platform. And so, I get that, but I do think actually the real solutions on the ground are going to have to be a little bit more creative than just doctors and nurses, much as I love doctors and nurses.
Yes, you do. Okay, let's do the Liberal plan now. Sheldon, if you would, the next graphic, creating a new ministry focused on seniors, which would oversee long-term care and home care, increasing the annual budget for home care by more than $2 billion annually, creating 15,000 new assisted living homes consisting of smaller residences, creating a dementia care network, and again, there's that Get Rid of Bill 124, the bill that would limit salary increases for people in the healthcare system to just 1%. Sheldon, that's what I want, a four-shot there. Any takers for this plan here? Who likes what they hear?
I'm happy to step in.
Sure.
Indeed, there is an emphasis here on long-term care. Our seniors paid too high a price in COVID. And we know, as per the prescription for Ontario and the consultation, that this is indeed a priority. Traditionally we think about people get sick, they come to the emergency department, they stay in the hospital. When we talk about how much it's going to cost to rearrange things, we need to know that it actually costs about $500 a day to care for someone in the hospital. It costs about $150 a day to provide that same care, but in a long-term care facility, and even less money spent to provide that same level of care in someone's home.
So the economics are obvious.
Absolutely. And so there is savings to be found. And then the emphasis on providing care for people where they are when they need it needs to be looked at very seriously. So if indeed this platform is addressing that, then fantastic. We're about to come out with our report card next week, and we're happy to share it with Ontarians, sizing up each political platforms and how it aligns with the prescription for Ontario. And we'll be happy to share that information.
Dr. Zacharias, why don't you just scoop yourself tonight here on TVO, because we've given you the platforms. Just give the letter grades out right now. Come on, go for it.
So if platforms indeed line with the prescription, if they are having a serious intention of catching up on the backlog, if they are investing in home and community care, if they are dealing with the mental health infrastructure and investing in it there, as well as that public health strategy, and as well as Dr. Danielle Martin has very aptly put it, providing healthcare teams, providing all of the players digitally connected and working together to provide the care. We talk about mental health, and that is actually a very specific example where you need a team. We need community-based, publicly funded psychotherapists, actually, to meet the needs of our kids who have struggled with their mental health in COVID. The school closures, the uncertainties of income loss in families, those are real and present stressors in kids' lives. And so it's a little complicated when you say, well, build a bigger hospital and care for people. That's a need that wouldn't be met with a bigger hospital. That will be met with healthcare teams, community care investments. And so that's what I'll be looking for. That's what the OMA is looking for.
Well, since you brought up mental health, and since the clock is ticking faster than I want it to be, let's pick up with the Green Party plan here, because it very much focuses on mental health. For example, expanding access to mental health and addiction care under OHIP. Have the health insurance plan pay for it. Increase mental health spending from 7% to 10% of the healthcare budget, and invest in youth mental health care. Have a mental health wait time reduction strategy, and supporting Indigenous-led mental health care clinics. Dr. Banerjee, what do you like or not like about any of that?
I like all of that, especially the Indigenous-led mental health care system. I think if we can get more access to not just physicians, psychiatrists that deal with certain kinds of mental health issues, but if we can get funding for people that can't afford seeing a psychologist, I think that's very important, because I think that there is, as people said, there's going to be a tsunami of people with, where they need mental health support moving forward.
Dr. Martin, sum it all up for me here, in as much as people are looking for whatever good may have come out of this pandemic. I don't know, what we might have learned new that we didn't know before. Resiliency of the healthcare, I don't know. You tell me, what good came out of the last 2 years?
To me, the most important thing about this pandemic is that it has changed the way that we all talk about health, to acknowledge that your chances of getting sick and dying over the last 2 years depended on where you live, on what your income was, on what your job was, on what your housing situation was. All of this talk about the so-called social determinants of health, that the social factors that contribute to whether we get sick or stay healthy, suddenly are being acknowledged and talked about. Suddenly we're talking about sick days for working people. Suddenly we're talking about unsafe work environments. And so, the notion, and to be honest with you, Steve, although I'm very happy to talk about analysis of healthcare platforms, truly, if we want to know how these parties are committed or not committed to health, we should be looking at their economic platforms. We should be looking at their social services platforms. We should be looking at the way in which they're approaching education. We all saw in this pandemic that those are the things that determined who got sick and who died. And so that, to me, is the biggest opportunity, is for us to talk about health beyond just healthcare. And I really hope that we don't forget that lesson as we look forward to what the future should look like. It cannot be all a conversation about hospital beds. It's got to be a conversation about the root causes of health and illness.
Dr. Martin, that is excellent advice, and I can assure you we will be taking it here at TVO over the next month as we put all of the platforms on all of the things that you just mentioned into the meat grinder, so to speak. Dr. Rose Zacharias from the Ontario Medical Association, Dr. Danielle Martin at the U of T, Dr. Anna Banerjee at the U of T, Catherine Hoy, Ontario Nurses Association. Thank you all for joining us on TVO tonight.
Thanks, Steve.
Thank you, Steve.
Thank you.
It's probably fair to say that no one wants to have to call in the Canadian military to backstop long-term care in Ontario ever again. That's just the most glaring instance of trouble revealed during the pandemic in caring for older and frail Ontarians. It's not the only trouble, not by a long shot. What have the parties learned, and do they have solutions on offer in election 2022? Let's find out. We'll ask. In Aurora, Ontario, Charlene Stewart. She's president of the SEIU Healthcare Union. And in the provincial capital, in the St. Lawrence neighborhood, Donna Duncan. She's the CEO of the Ontario Long-Term Care Association. And from his office at Mount Sinai Hospital, there's Dr. Samir Sinha, Director of Geriatrics at Sinai Health and the University Health Network. And as I welcome the three of you back to our program, I occasionally have to do this in the interest of full disclosure thing. My wife's a health policy consultant, and about a dozen years ago, she did a policy paper for the Long-Term Care Association. Donna, that was a decade, or about a decade before you got there, so but, for what it's worth, we put that on the record in the interest of full disclosure. All right, let's get into this. Samir, the biggest problem in long-term care that it had to deal with during the course of the pandemic was fill in the blank.
Staffing 100%. Again, we were already grossly understaffing our long-term care homes prior to the pandemic. And that only led us into more trouble and a lot more challenges in trying to get out of it as well.
Just put a little more meat on that bone. When you say staffing, you mean what exactly?
Well, I mean, the people who provide the care in our homes. Right now, our government was providing about 2.7 hours a day of funding, and its own staffing commission that it set out actually said that we need to be providing at least 4 hours a day of care. So already we were underfunding our homes to provide adequate staffing. Our staff aren't paid well to begin with in our long-term care homes. They're paid far worse than working in a publicly funded hospital versus a publicly funded long-term care home. home. And we knew that the majority of homes prior to the pandemic were having trouble recruiting and retaining staff. So that really set us up for failure right off the bat. And it really made it a struggle to continue to providing high quality care throughout the pandemic. And frankly, it's going to be a struggle to reach the levels that we need to moving out of this pandemic as well.
All right, we're going to spend the next 20 or so minutes looking at the platforms of the four major political parties in Ontario during this election campaign. And then we'll get the three of you to comment on the strengths and weaknesses thereof. Let's start with the former governing party, the Progressive Conservatives. Here's what they have offer when it comes to long-term care. They say they will provide 30,000 more nursing home beds by the year 2028. They plan to spend $5 billion to hire more than 27,000 long-term care staff. They would ensure long-term care residents get an average of 4 hours of direct hands-on care daily. And they offer $8.3 million over 3 years to add 40 behavioral specialized unit beds at long-term care homes in Ajax and in Mississauga. Okay, Donna Duncan, start us off. How does all that sound to you?
Well, it's a start, but it's also a start building on significant movement that has happened over the last 2.5 years. And it's tragic that it took COVID-19 and thousands of deaths in order for a government to move forward after decades of lack of investment. We know we need to rebuild our homes. We know that we need to modernize homes. We need more spaces. We're not going to build out homes for everybody, but we need more and better. And we need to make sure that every community in our province has access to long-term care supports. We need to recognize that who our residents are and build out more structured relationships and better staffing models and staff teams to be able to support our residents. As we look at those 27,000 staff, we estimate we'll probably need more than 60,000 once we add the need for workers with those new spaces that have been committed. Government hasn't put its mind to how and where we're going to find those people yet, knowing that home care needs more staff, hospitals need more staff. There's more work to do by anyone who forms government to really understand who's going to be retiring over the next year and what the real scope of the HHR problem is. But work has been done. We have more partnerships with hospitals, emergency services, and others than we ever had before. We have more IPAC. We have relationships and more formalized in legislation today now, relationships with our family caregivers, and that's an important thing. We need to keep moving forward on important initiatives that the government has done, but there's clearly a lot more to do.
All right, Charlene Stewart, if in fact a lack of workers in the system is problem number one, do you think the Tory platform goes far enough to address that?
No, and first of all, Stephen, let me tell you, I am very excited and thrilled to see senior care a top priority in all of these platforms. It's long overdue, and I'm excited to see that they're addressing it. And I'm happy that the public is demanding it, quite frankly. The choice in this election is either continuing the status of a failed system, status quo, which quite frankly, we've seen it. It definitely, the status quo, what we've seen has exploited female-dominated workforce. We know that it is. It also, the status quo has demonstrated terrible outcomes for seniors versus bold reforms that focus on care instead of the profits of the nursing home corporations. And I'm afraid that's what I'm seeing. It's witnessing in one of the platforms that it's making a bad system bigger, not fixing a bad system and making it better. It means having elder care be about care and not about the needs of for-profit business to deliver for shareholders. It means not having nursing home executives mandate from corner offices the rationing of adult diapers for our elderly moms and dads, or limiting how many baths are given each week just so they can squeeze out more profits. And again, what's exciting about these two platforms is that there is recommendations of complete transformation or reform, thinking the way people at home are thinking. We've heard them. We need to revolutionize the long-term care system. I'm worried that even after what we've seen over the past 2 years, Doug Ford's plan, there's a lot of promises in it, but unfortunately, I see that just doubling down on a system that's not working, the status quo. The other two parties are definitely.
Well, hold off on them. We're going to get to them. We're going to lay out in chapter and verse what they've got on offer. But okay, I take your point on the Conservative platform. Samir Sinha, why don't you come in here and tell me what do you like about this platform? What do you think doesn't go far enough?
I think what I like about, this platform and the other platforms is that there's more investment being focused around, care for older adults and particularly people who might need long-term care supports and services. The problem that I agree with Charlene is that this is just more of the same. Fundamentally, this platform doesn't talk about a fundamental change. It just says we're going to double the size. We're going to build 30,000 more beds. We're going to build them to pre-pandemic design standards with 2 or more people to a room, even though the new national standards for long-term care say it should be 1 person per room, smaller home models. No, we're building more of the same and not necessarily fixing basic issues like air conditioning or making sure that we actually have things like wage parity so that people working in these systems actually have access to good benefits and actually a reasonable paying job. And I'm not saying make more money than people who work in hospitals, but make the same in a publicly funded system. But also thinking about this is a platform that frankly is all about building more beds, building more of the same. It makes, as Donna said, staffing projections, we're going to hire 27,000 more workers. Well, our own government's budget office said, actually, for your plan, you're going to need to hire 35,000 new workers just for what you're actually planning right now. So you haven't thought about those extra people. And right now you're talking about 4 hours a day, but that's an average across the system. It still means that we could actually have homes that are still operating with less than the staffing that they need and not being penalized. And it's great that we're talking about having tougher legislation, but we haven't fined a single home. We haven't taken away a license. And we put a liability shield saying, hey, for all the negligence that occurred, not a problem. We're going to make sure that you're okay. So I'm a bit concerned that this platform is one that just speaks about more of the same. And I think all parties are talking about building more beds and just doing more of the same thing, as opposed to necessarily saying, how do we think about long-term care more broadly? And how do we really look at true system transformation?
All right, that's the Conservative platform. Let's look at the other parties' platforms as well and see if there is anything closer to what you would like in any of those platforms. The NDP were the official opposition in the last legislature, so they're coming second. And here's what they have on offer. Immediately begin building a public, nonprofit system to provide home care and long-term care. Immediately build 50,000 new and modernized beds into the long-term care system. Create new and stronger protections, such as comprehensive inspections and a senior's advocate. Build more small, modern, family-like homes and provide a caregiver's benefit program for informal caregivers. All right, let's start with Charlene this time. What do you like about what you see there? Where do you think it falls short?
Well, like I said, they are definitely showing a more bolder, progressive vision of what they see a long-term care, senior care being. I am pleased to see that they are focusing on home care as a solution because let's be honest, in Ontario today, long-term care has become a place that nobody wants to be. And we should deliver care where people want to be. They want to be in their home. And that is exciting to see them focus on home care. Yes, the universal wages across the system is also what's going to help us with the retention and recruitment problems. Right now there's a shortage of long-term care, especially PSWs and RPNs. So to have a universal wage across the system so that the competitive model is not there because these workers are following the money. Again, it's more modernized in the 21st century, 2022. I think that's a start. We have to start looking at giving people who we care for the care that they want in this time and caring for those who care for them because they're so very much connected to each other. So that's what I like about that platform.
All right, Samir, what do you say?
Yeah, I think this is a more progressive platform that starts thinking more about system change that we actually need. Because again, when we talk about building more beds, right? We had our premier there a few weeks ago standing in front of a 320 bed new building in a parking lot of a hospital, right? And I remember seeing them pan at the rooms and what they look like. I'm sorry, but that's not a place that I think feels home-like, looks home-like. And in developing the new national long-term care standards, this wouldn't actually meet what Canadians and what the experts say that we actually need. So I like the idea that they're saying that if we're building new beds, let's actually build more small home-like settings where the evidence actually says you get better outcomes of care for not only the residents, but also better conditions of work for the workers. But they're also thinking about, again, how do we think about our workers and how do we actually think about more ways of supporting people to stay in their own homes? Because when you continue to grossly underfund our home and community care system, you then artificially inflate the wait list. Because I have so many patients who don't need to go into long-term care. We know CIHI, our Canadian Institutes of Health Information, says that in Ontario, perhaps a third of the residents in our long-term care homes could have been supported in the community if there was adequate home and community care. So again, how do we think about greater system transformation that's delivered in a more equitable way?
All right. Donna, do I assume that the first plank of the NDP platform, namely to get rid of all private long-term care homes, that's kind of a non-starter for you?
Well, we estimate that to the original Conservative platform, if we were looking at 45,000 spaces, if the government were to build it, that would be between $13 and $15 billion. We need to rebuild our workforce, and it's going to take all of us working together to rebuild the sector, and we're going to need the private sector in building out our homes. People don't choose to be in long-term care, and Charlene, I think you and I both know that we need to instill pride of work and recognize and value the heroes who are long-term care staff and validate the work they do. It's really important work. It's very challenging in working with families and the care needs of the people who are living in our homes. We know that those care needs are only escalating, and Samir, the most recent CIHI data from John Hurdy's in a recent news article said 9% of the people should be in long-term care. So we do need to build out home care. We need to make sure there's a workforce for home care. We need to make sure there's a workforce for long-term care. We need to deal with the wage disparities. We need to make this an attractive system, and we need to support our residents and our families, recognizing that for so many and too many people, staying at home is not going to be an option. And yes, we do need more home-like environments for emotion-focused care, but the reality is, and we're seeing it, and we're waiting for the data to catch up, the people who are coming into our long-term care homes are end-stage dementia, people with very, very heavy care needs, and Charlene, you know this from your team members, people who need heavy mechanical equipment, more specialized services and supports. And we've got to understand that we've got to recognize the geography of Ontario. Home care is a real challenge in rural, remote communities. We know that our largest homes actually are hospitals, to your point, Samir, and municipal homes. In our small communities, we have small homes, but we have severe staffing shortages, and we've got to step back, differentiate the system, have more specialized, customized long-term care homes. We know baby boomers aren't going to accept what we have today, not a cookie cutter.
Okay, Donna,
So
let me
it
jump
has
in
to
there
be
if I
about
can.
change.
Thank you. Just I want to make sure we save time for everybody's platforms here. So let's move on to the Liberals, who, like the NDP, want to see an end to for-profit care, but they are going to do it in a different way, and they would take more time to do it. They would end for-profit long-term care by the year 2028. How? By no longer renewing licenses and financing the transfer of existing for-profit homes to the not-for-profit and municipal sector. They would also, the Liberals say, build 30,000 new long-term care beds and modernize 28,000 spaces. They would ensure long-term care residents get at least 4 hours of direct care daily, as recommended in that famous report. And they would raise the minimum wage for PSWs to $25 an hour. And I guess just before I get everybody in here, Sheldon, let's bring up this next graphic as well, because this will help us understand the difference between the sort of public and private aspects of this system. Here's Ontario long-term care by the numbers. There are 360 for-profit homes. There are 162 not-for-profit homes, and there are 101 municipally run homes. So as we think about, as a couple of the parties want to, privatizing the current system, that does give you an indication of the challenge ahead for that. Okay, that's the Liberals' plan. Samir Sinha, start us off. What do you like? What aren't you sure about?
Yeah, so I mean, the key is right now that this current government has already actually given away most of the licenses. So they've already given out about $6 billion, to provide support for building 30,000 new beds and then focus on redeveloping 28,000. So a lot of these licenses have already been renewed, and so transferring licenses and moving a largely for-profit system and 30,000 new licenses that are largely going to be going to for-profit holders, it'll make it very expensive to transition a for-profit system where it's not only about ending licenses, but if you want to keep that property in the land, the government, while it paid for all this and it's given it away to these for-profit operators, it would ironically have to buy all that back. So as Donna said, that's going to be billions of dollars. I think what I like more about this platform is that they, again, are focusing on the fewest number of beds. The NDP have said, we want to build 50,000 new beds, right? No. 30,000. I don't even think we need to build that many, to be perfectly honest, because if we adequately funded our home care system better, we could actually support more people to live in their own homes. So what I do like is that in this platform, accompanying these statements are two other things. One is they've made the greatest pledge to build out our home care system more. 2 billion versus 1 billion for the other parties, to say, let's give 400,000 more people home care, because 1/3 of Ontarians who have home care have unmet home care needs, which drives them into long-term care. And the other thing is, while the current government is talking about a $3 PSW wage increase, yay, the NDP have talked about a little bit more of a wage increase. This is the party that said, let's set a minimum standard PSW wage rate of $25 an hour, which would actually provide a much better living wage than we currently have, that the other two parties are offering. So I think there are more elements here that I find useful and helpful to get us to more of where we need to be. But again, it's a lot of tinkering, not as transformational as I think it could be.
Donna, what do you see here?
Well, again, $13 to $15 billion to take over beds, and what we're reading with the Liberal platform is they're actually going to close the beds, and so that's 43,000 spaces for long-term care when we have 40,000 people on a wait list today, and we are about to face the biggest wave of octogenarians in Ontario in our history. We don't have the frontline staff. We would much rather see those that $13 to $15 billion invested in our front line, and whether that's in home care, long-term care, home, community care, mental health care, it's going to take all of us working together and isolating and trying to dismantle long-term care at such a critical moment when we know it's going to take hospitals 3 to 5 years to recover from the pandemic. Closing homes over the next 3 to 5 years is so disruptive to our workforce, to our residents, and to our families. This is a time to build. We're committed to building and working with whoever forms government is going to face this stark reality, notwithstanding their commitments in a campaign.
Charlene, your view of the Liberal platform?
Well, I mean, phasing out of the for-profit system is going to take time and it's going to take money. There's no doubt about that. Nobody's denying that. But it's the time to do it. Donna talks about the money. Well, maybe the billions of dollars that are being put into a new highway could have been put into the transformation of long-term care, a highway that not very many people are going to use. And we've got, numbers that are like just exploding for future use of senior care, not just institutional care. So, let's be honest about the kind of corporations that dominate long-term care. They are not in the business of care. They are in the business of property and making money. And that's why you see the results and all of those numbers that were up there in those for-profits. We've got the data on it. We all lived through it in the last 2 years. The flags were up before the pandemic. But those corporations have fewer staff and fewer full-time staff. They have lesser paid staff. They have greater staff turnover. They have more frequent admissions to hospitals for things like bad sores and other infections. Look at the lawsuits from families for systemic neglect that happened over the last 2 years and prior to that. So instead of investing profits to improve care, they deliver those profits to the shareholders. And we know that. We saw that over the last 2 years, that the for-profits made sure that their shareholders got their money off the top, even when others were suffering during this pandemic. So every single large nursing home is looking at the opportunity to make more money over the next decade. And like the doctor said, why, when we know that the for-profit performed much worse, did we give companies like Sienna, who the armed forces said were deplorable, giving them licenses for 30, 35 years? Like, that does not indicate that this government today is really serious about charging those companies for the bad performers, that they are definitely have no intention of even starting to balance out the for-profit versus the not-for-profit. They're just doing a status quo of a system that is broken. And this election is our time to say, no, we want different, we saw different, and we're going to demand different.
Okay, let me... Okay, Don, I know what your position on much of what Charlene just said, so I want to go to Samir to get a response to that. The quote was, the private operators are not in the business of care. Samir, do you think that's a fair statement?
No, they're in the business of care, right? Everybody here is in the business of care. It's just, what is your ultimate focus and what is it about? I think the challenge, why the whole issue of for-profit versus not-for-profit has become an election issue, and why two parties are focusing on this and talking about phasing this out, is that prior to the pandemic, we knew that when you look at the literature, the evidence that is available out there time and time again, on balance, we find that for-profit operators of long-term care tend to have poor quality standards. Charlene helped to lay all those metrics out that we know time and time again show. We know during the pandemic that again, we saw poor performance, and especially around large chain operated homes. And the challenge was that it's not just the fact that we have a system where, again, if you're a not-for-profit operator, you're not looking at making a profit. When you're a for-profit operator, you've got to make a profit, and you've got to be in the business of delivering care. This is a challenge, because you're trying to do this in a grossly underfunded system. This is bad, especially in a system where we don't have very good enforcement systems. Again, this was a government that actually did away with our comprehensive inspection process right as the pandemic was running up. It's created more tougher legislation that it's actually never really used to actually take away a license or deliver a fine. It's actually rewarded a lot of operators who haven't done terribly well with more licenses, and more licenses do the same thing. And it created a liability shield saying, again, only if you have gross negligence and it can be proven by these families and these workers will you get sued. So it's a business, frankly, that you can't lose money, even if you tried, frankly, as far as I'm concerned. And that troubles me in terms of a basis for building a bigger system that incorporates those attitudes.
All right, let's just get the Green Party on the record here for what they have on offer for long-term care. They would retrofit all provincially owned buildings with priority given to community housing and long-term care homes, and they would increase access to mental health care workers in long-term care residences. I have literally a minute left just to ask. I want to ask Donna and Charlene. I mean, yours are kind of political action committees, not just organizations. Do you intend to endorse any party before Election Day? Charlene, how about it?
No, SEIU doesn't come out and endorse. We definitely endorse the platform and the work that they are committing to do. We've met with many of these politicians, and what's great about some of them, not all of them, including the one that's running for re-election as premier, have met face to face with our members. So they talk to us, we share our...
But no formal endorsement coming?
No formal endorsement. It's more on the plan that works for the frontline workers and the seniors.
Understood. Donna Duncan, how about your association?
Well, we've met with all the parties as well, Steve, and notwithstanding the focus on ownership, we've been really clear with all parties. We're going to work with whomever gets elected. We represent nonprofit, for-profit, and municipal homes across the province, and for us, the focus is on people. You'll see us focusing on our residents, on our staff, on our caregivers.
But no endorsement
that's
coming?
The focus.
Okay,
No endorsement on any one party.
Good to know. Samir Sinha, Donna Duncan, Charlene Stewart, as always, we're grateful for your time here on TVO tonight. Many thanks.
Thank you.
Thank you. Stay safe.
And that is the agenda for Thursday, May the 5th, 2022. Tomorrow, Nam Kiwanuka gets an update on the war in Ukraine as Russia ramps up attacks in the western part of that country. I'm Steve Paikin. Thanks for watching TVO, for joining us online at tvo.org. And Nam, we'll see you here tomorrow.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.